We are, I guess, live. Let me just share a link with you.
Right.
Oh yeah, if you go top left, it says copy streaming link.
Okay.
Oh, cool.
Have you guys found the link?
For some reason, I haven't, but I'll figure it out.
Just give a minute. I will share it with you guys.
Oh, found it. Good.
कि मुझे रिस्पांस नहीं आ रहा तो थोड़ी सी मैंने चेंजिंग की है आज से अप्लाई।
Okay, guys, I am pasting the link in the chat. You guys can share it. So, welcome everyone. We are live with another live session on COVID-19 with global shapers from North America. So basically, this is 11th session of this series. Just before this session, we had a session with China. And the purpose of this session is to bring all of us together, all the shapers together, get verified information, on-ground information from each region, and learn from each other what are the best practices of each region and how we can adopt each other best practices. So today I have Will from Medicine Hub in USA. Then I have Nefali from Providence Hub in USA. And then I have Samantha from Halifax, Canada. So welcome everyone.
Thanks for having us.
Thanks for having us.
Yeah. So, and of course, I am Abu Bakr from curator of Faisalabad Hub. I will be moderating this session. So I would like to start with you, Samantha. I would like that you introduce yourself to our audience, what you do for living, and just general background about yourself.
Sure.
Over to you.
Yeah, so my name is Sam and I live here in Halifax, Nova Scotia. Nova Scotia is a province within Canada and it's on the east side of Canada, so kind of closer to Europe than Vancouver, which is on the other side, which is closer to Asia. And I've lived here in Halifax for 3 years. What I do professionally, I work for a startup called Squiggle Park, and we have video games that help teach kids how to read. So my life was remote before, working with teachers all over North America, and that continues to be the same now. So really lucky to still be employed and still be helping and support kids while learning from home. I'm the curator of the Halifax Hub here. I've been a shaper for about two or 3 years, and happy to be joined here today. If you have any questions, you're welcome to ask me more too.
Sure, we will, everyone is encouraged to share their comments. If you want to ask anything, you can just post it in the comment section of this live feed. So we can ask it from our panelists. Then Nefali, I would like to you to introduce yourself.
Sure, yeah. So I'm the curator of the Providence Hub. Providence is the largest city of the Rhode Island state. We're one of the smallest states in the United States. We are kind of in between New York and Boston. We're about an hour from Boston, about 3 hours from New York City. And I am a philanthropy consultant. I help design prizes and competitions for philanthropies and other big foundations. So I have been extremely lucky to have been working from home for 2 years now. So I was already set up to work from home, maybe similar to you, Sam. I have my office and everything else. So very, very fortunate to still have employment and to be able to cover expenses. And yeah, very excited to be here with you guys.
Great. Will, over to you.
Well, yeah, thank you very much. So Will from the Madison Hub in Wisconsin, which is sort of in the north central portion of the United States, sort of near Chicago, if people are familiar. And I'm an attorney, and I've been lucky to also be able to work remotely since early March. And I think that the projection is that'll continue for pretty much indefinitely. And I'm the vice curator of the Madison Hub, which is new as of last January. So there's sort of a long tenure of curator and vice curator is almost a year and a half now, but wrapping up. And we're very excited about getting the Madison Hub on board, and it's been wonderful to meet everybody so far.
Great. Our Faisalabad Hub has also started last year around the same time, I guess in April. So we are also a relatively new hub. So I think today's session is very important because when we see the figures, statistics, even though this whole thing's originated from China, but as of today, we have 3 million cases and 1 million out of them are in USA. So from that perspective, and most deaths, 50,000 deaths have also been in USA. And relatively Canada is much safe, but still 45,000 deaths. It is also in one of the top lists. So from that perspective, this session is like very important. Starting from you, Sam, how is the current situation, on ground situation in your city and overall in state and country?
Yeah, so I've been social distancing, staying mostly at home since March 15th. And a lot of the country has. All non-essential businesses are closed, but essential businesses are still open. It's not complete lockdown. We can still go for walks. You can still go around your community. You can drive to the grocery store, but there's limits of how many people can be in a store at a time. And people are all staying 2 meters away from each other for the most part. The government, we'll talk about this more later, but the government has provided a lot of grants for businesses to keep employees. And we also have emergency response grants for people as well. So even though the economy, of course, is different now and is not doing as well as before, there are a lot of supports for individual people. Again, as with everywhere, the frontline workers are working really hard, and it's continuing to be more and more difficult as more become sick, and then there's more pressure on the people who are continuing to work as well. I'd say like mental health is a really important thing right now, and that's what I try to focus on with my community and my friends. But in general, life is different, but I'm happy to stay home, and I feel like most Canadians are just waiting out and hoping the community will be able to rebuild afterwards.
Great. Nepali?
Yeah, so
is it any different, like is it in USA any different from what she told about Canada?
So I guess there's a distinction between, the US and Rhode Island. So I can definitely tell you about the situation in Rhode Island, but I think it's very different depending on the state that you're looking at in the US in general. As far as Rhode Island goes, it is quite similar to Nova Scotia. So we have been under a stay-at-home order since March 28th, so about a month now. But we're not in full lockdown. So like Sam said, people can still walk around. You can still go for a walk. The parks and the beaches and all that have been closed down. And especially when the weather is nice, like it was yesterday, you can see police all around trying to make sure that people are not going to those areas. And overall, we have essential businesses open. There was a mandate from the governor to have all employees and any clients who go into grocery stores, for example, to wear masks. I think they're still trying to figure out how to truly enforce that and what happens when people don't do it. But right now, people are being careful. Like every time I go out, people are wearing masks and are trying to stay away from each other. Even though they still try to go jogging, they have to walk their dogs and all that. And in general, Rhode Island, even though it is the smallest state in the US, we are quite densely populated. So there are pockets of Rhode Island where people don't have really the option to be so far apart from one another. And they don't always have the same access to information or healthcare. So it gets a little more complicated there. But I would say in general, we're doing well in terms of cases. We've had about 7,000 cases so far, and we've been testing quite a bit. So I heard the governor say a couple of days ago that Rhode Island has the highest testing rate per capita. So they're trying to really push on the testing part to make sure that we can reopen as quickly as possible. And CVS, which is one of the big employers here, has set up drive-through testing sites. And I think yesterday we tested like something like 3,000 people. But we're still seeing cases. There's still an increase in cases, but there's not the surge that we could have seen if some of the measures were not working. It'd be interesting to hear Will's perspective from another state.
Yeah.
Will, how is the situation different in your state?
I would say it's socially similar and statistically smaller, so that you see a lot of the same effects where parks actually aren't closed. I think the state parks are closed, but sort of the municipal small ones are open, and people are in them, but they aren't really close together. But there's a lot of bikers and walkers, and so people are sort of out. I live on a well-trodden path of walkers, and it's interesting because I think there's more walkers out than usual. But the city itself has been been shut down since I think mid-March, and it's interesting. And so we're the second largest city in the state, and I think Novelli just said she had thousands of cases, 7,000, and we only have, I just looked, Dane County, where Madison is, only has 401 positive cases. On the other hand, that's like the testing numbers, so that's people who have tested positive, who I think have been to the hospital. So it's not necessarily indicative of the path of the virus, but we're sort of lucky in that because we're a secondary or tertiary city, travel wise, probably we shut things down before people were overly exposed. But socially, to have, I think United States is a little bit unique in that we're dealing with people protesting some of these shutdowns. And over the weekend, yesterday was, or on Friday, I think, we're also the state capital. And so there were 1,500 people that came and protested our state's shutdown around the Capitol, which is kind of interesting. And so I would say things seem to be the same. I think we're lucky to be dealing with less cases, but everyone's sort of locked away at home, and the only thing they're doing is getting out and about, walking around. And masks are frequent. I would say 3/4 of the people I see outside at mass if they're in a building.
Is there any specific reason that, even though everyone has awareness that there is a specific reason for them to stay inside home, is there any particular reason they are protesting? Is this about the economic situation, that they are out of jobs, they want to come out and work? Is it because of that, or what is the reason? Why are people protesting?
I think it's a variety of reasons, and I don't know enough about all of them, but the context is that Wisconsin is, for many reasons, a very divided and partisan state, both in its state politics and the national politics. It's what's known as like a swing state. So there's a lot of interest in political outcomes in Wisconsin that drive a lot of protests and a lot of money being funneled into persuasive means. So basically, like our Democrat governor, there's a larger trend of, depending on if the way American politics works, so we have the governor from one party and political representatives from the other party, and they can be upset about how the governor handles it, and sometimes that can be grandstanding. I think there's a legitimate gripe that people have if there doesn't seem to be the process that I think the whole world is maybe dealing with, but I'd be curious what you guys think is, what does it look like for everybody to get back to work, and how do you phase it in slowly? And I think it's difficult, and I think we're all lucky sort of to be able to work remotely, but not everybody can do that. So I think there's some frustration there. I think some of it is misplaced because obviously nobody wants to be stuck at home. but I think in part to the extent that there's some legitimate grievance to it, it's that they would like to see a legitimate plan that's going to help them, and with different ways that federal and state aid works, we'll see how useful the different state strategies were. So that's about it. And then I think some people just show up because it's something they'd like to do, and they'd like to go be angry
and hold signs.
Yeah.
So, and if how is situation different in Rhode Island? How are people responding to restricted movements enforced by the government?
Yeah, so we haven't had the big protests that other states have seen, but we've had some. And I think, as Will said, it is a combination of people just reacting to the economic impact of this, and saying, we need to have businesses open, because otherwise a lot of those businesses are never going to recover. And then you're looking at years and years of financial struggles. But part of it might be, and this could depend on the state, that if you're not seeing with your eyes how bad this thing can get, you tend to not believe the severity of it. And you tend to not understand, like, why do I need to stay home? Like, everything is fine out there. Everyone I know is fine. So why am I doing? But I was listening to one of the healthcare providers who was saying that if you don't see it, it means that it's working. Like the measures are working, and that's what we want to see. Like, we want to go through a long period where it makes no sense that you're at home, but that's exactly what we're supposed to be doing. So in general, I would say Rhode Island is doing well around like following some of the rules. But again, like I said before, there's pockets of it that are either not informed enough, so are not following the instructions by the government. And some of it is just, we have the highest rate of cases in our Latino and African-American communities. And part of it is that all of the guidelines that go out are in English. So you have pockets of populations where their primary language might be Spanish, or any other language, that are not even getting access to reliable information. So now there is an effort by the government to translate everything, at least in Spanish, and make sure that they have partnerships with Spanish radios and anyone else that helps distribute information within the communities. Because there's only so much, like, people. I'm watching the daily briefings, but not everyone is tuning in at like 2 or 1 p.m. to watch what the governor is saying.
Okay, so Sam, Nefali talked about information. So we have seen that there is a lot of misinformation which has coming up, which is spreading like fire. So how do you think is your government dealing with this fake news and is like providing the authentic information to different demographics in the country, or at least what you know about your state?
Yeah, that's a good point. So just a kind of overview, there's about 38 million people in Canada. The province that I live in is quite small. We're under 1 million. But all of the briefings that are happening, well, there's provincial briefings daily and there's federal briefings daily. I know a lot of people who are watching the federal briefings. They're in both of our official languages, so French and English, but of course there's many other languages that are spoken in Canada. I should look into more information about how they're reaching all different communities. In general, it seems like, for example, I think there's been 22 deaths in Nova Scotia and about 800, 900 cases. So relatively small, but we're quite a small province as well. I think you could always communicate better, but I also think that our media might be a bit different than the United States, where it's as much as it's partisan, sometimes there's not the different media outlets that only talk about a certain type of news or a certain message. I find that a lot of people are getting information on things like Twitter and on Facebook, and hopefully most of the fake news is being shut down quickly. But like, for example, the thing that obviously is on so many people's minds are the comments of the President of the United States around what you should ingest, or if that should be information that should be spread. But when Canadians receive that information, it's more like, oh, that's something, again, that's being spoken about that we don't think is true. So I hope that most of the misinformation is not being spread, and I feel like we're doing okay.
Okay, so Will, how do you think, like, there is also, like you mentioned, there is a lot of misinformation coming from Twitter, Facebook, and social media platforms. So how do you think is the country USA trying to deal with this misspread of information through digital platforms?
That's a good question. I don't have a lot. Not well. I mean, I don't. There's Facebook and Twitter and so on, and tech companies, and sort of the question of whether they have a responsibility to do something about it. And I think they've historically struggled to do that effectively, or even come down on the right side of the ethical questions. They're sort of America is somewhat, as our First Amendment free speech rights are important, and the in the broader context, I think apart from coronavirus, in just election campaigns and so on, I think people didn't realize until recently, a year or two ago, the amount of misinformation on social media and the effect it had and the interest. And so in connection with the protesters, it's like fairly easy to find evidence that a lot of those are being funded by groups that seek to sow that type of misinformation. And so I think that, I don't know how I think I'm not sure there's a federal or state initiative to do much about it. I think they sort of tell people, like, you have to be smart enough to figure out I think it's a big problem. And with the laws, here's sort of an interesting thing I saw recently, that apart from the hit that newspapers were already getting, sources of news that now are sort of sometimes deemed biased, but have traditionally been well funded and have like sort of objective journalism, are struggling. And if coronavirus begins to wipe them out, it might be sort of like the last knell because you can get your news however you'd like now. You can go on Facebook and find it and so on, and get it from whatever sources. And even it's interesting, just in Googling and preparing for this, you can Google various things, and it's interesting to see what sites pop up and what they're saying. So I think it's difficult. I don't know. I don't really have an answer. I don't know. Maybe Natalia, you guys are doing better in Rhode Island about information security.
I think you're right that it's very complicated on a national level in the US, because you do have some confusion that is coming from the presidential briefings. And there are moments where they just go back and forth on what is a guideline and what we're supposed to be doing. I think on a state level, for the most part, at least from what I've seen in the states in our region, New York, Connecticut, Rhode Island, Massachusetts, they try to be a lot more careful with the information that they provide. And even the daily briefings, I feel like we have to, I don't remember a time where that was ever the case, where you had the government leaders across the world delivering daily updates to the entire population. So I think that in and of itself is one of the really positive aspects of this. And if you want, like, you can get access to that information. And other than that, I think it's on an ad hoc basis. Like what I said before about, the Latino population, the government realizes, oh, we have a problem there. We're going to find, like, what are the popular radio stations and TV stations, and try to partner with them to make sure that the information is disseminated. But I think to a large extent, this is something that no one has experienced before. So there are not even the systems in place to address this. Not on a state level, but more so on a federal, national level in the US. So I think people are just trying to find different ways to share information, like accurate information on their own, kind of self-organizing. There is like an app here, I don't know, maybe they have it in other parts of the world, called Nextdoor. And it's connecting neighborhoods, like people living in the same neighborhoods. So I've seen like tons of updates on that. So people are resulting to more informal systems that still have the trust of the person that like your neighbor or your friend. to get that information. But it is definitely, it's a huge issue, especially in the US.
One of the best practices which I have come across from one of the live sessions was from East Asia. What the government in Malaysia is doing, that they have formed Telegram groups to inform public about the actual situation happening in the country. So I think this is one of the good initiative which a government is taking. So I think there is a room that other governments can adopt from this. Also, they are taking like severe actions against those who they find that they are trying to spread misinformation. So they arrest those people and give them punishment. So I think this is one of the ways in which we can ensure, which we can learn from Malaysia, the way they are trying to like curtail this issue.
Mhm.
Secondly, at hub level, what we are trying to do, our hub, we have partnered with local radio station. So we are running like awareness messages around the clock after some time in partnership with that local radio station. So that is what we, in our capacity as a hub, uh, are doing. So coming to you, Sam, how has been health response of government? Is there any discrepancy between the private sector and public sector, or is it the same? How is government dealing with the health sector as a whole?
So how the government is dealing with the health sector in
Yeah.
general, specific? I mean, so one
Like,
situation,
are there any? Is there any shortage of doctors, medical equipment, or ventilators? And
all of it. Of course, none of us have enough of anything, I feel like, honestly. I mean, of course, flattening the curve is what's important so that if people become sick, we can heal them as well. But where I live in Nova Scotia, we've always had a doctor shortage. It's just a place where we want to attract more doctors to come work here, but that was a problem that was before as well. One thing that we see in Nova Scotia and in other provinces is in long-term care facilities, a shortage of nurses, and because they're often at capacity already, so this is for older adults or people who need assistance, if one of the nurses gets sick, then the other nurses have to take over, because once you have symptoms, you can't be working anymore. And so one thing that happened in Halifax here was they were just being overwhelmed with cases, and people who tested positive were in the same rooms as people who tested negative, just because there's nowhere else to put people and move people. So once this became public knowledge, I think there is lack of communication between all of the different health areas right now and the government. But once that was actually brought by media, journalists that brought this up on Instagram, then they sent nurses from the hospitals to that long-term care facility to provide extra support. But it's not like the hospitals have an excess of nurses that can work either, right? So I feel like in general, we need more people, but hopefully that has shown that there needs to be better communication between these different facilities and making sure that there's all at the standard that they need to be. And I think they're all trying their hardest, but what can we do? We can't really train more and more nurses right now. Maybe that could come to a certain point, but it shows us that we need to have better capacity and better flexibility with our healthcare systems. They need more money, they need better facilities. And with an aging population, that's just gonna be more and more important. And this is just showing us right now that that's important.
Great to hear this perspective. Will, I would like to ask, I don't know whether it is true or not, but maybe it is also misinformation. But I've heard that in USA, they are refusing to like address older people. They are just letting them die and go away. They are just accepting the people who they think they can treat. So what can you tell us about that? And what is the overall situation in your perspective, in your state?
Yeah, I anecdotally I've heard that too. I mean, at first I think when it was really bad in Italy, we'd heard that, and then in potentially Seattle and New York. And I can't confirm that's true. I like reasonably if hospitals were, or the report I think is the hospital runs out of resources and they need to triage patients as if sort of in wartime, and those decisions I think are very difficult. And from what I'd read, potentially too, if they think somebody's morbidity is too high, they would sort of allocate the resources away from them. luckily in Wisconsin, we had sort of a head start both on when we quarantined and on getting resources ready. So that like hospitals here made additional allocations of beds and rooms and plans. And we have not, even at what was supposedly the peak, we didn't hit capacity in the ICUs in Wisconsin. So we were lucky in that respect. But I don't, in New York and Seattle, supposedly that was the case.
Okay, and Nefali, what do you have to add on? Do you have anything to add on this?
Yeah, I mean, I think as Will said, I think this is a very, very tough time. And when you get to the point where you have to choose between two patients, it means that things are really, really bad. And no one wants to be in that situation and make those decisions. Rhode Island has been doing well. We have actually prepared a couple of field hospitals with about, I think, 1,000 beds in case there is a surge at some point. That's not to say that the situation is not already hard. I think for any healthcare provider who is now at the front lines, things are tough, but I think they're still under control. And even though our cases have been increasing for the past couple of weeks, we have not seen an increase in hospitalizations, which is also key. Like you might have more people testing positive, but that it's not necessarily putting a strain on the hospital system. But I think it's toughest in the states that have it worse, like New York City, and that's where the decision we have to make. But I think this is a tough thing about the US, that we don't have confirmed information about what is happening across the country, and I wouldn't want to say anything that would add to the misinformation.
Okay, and do you have any information about how the insurance companies are responding?
In Rhode Island, that was weeks ago when they extended the deadline for people to sign up for health insurance once this whole thing started. And they are covering, like right now, all comprehensive plans do cover anything related to COVID. So from testing to treatment, because if you do end up in the hospital in the US without health insurance, you're probably guaranteed financial destruction. So there's a lot of that there, but then even on the Medicare side, we're going to see a lot more people signing up for that. As people lose their jobs, you're going to see a lot more people seeking Medicare. So I think, I don't know how that is going to be affected, because the more people you have, the harder it's going to be to provide care for everyone. But I think this is a larger issue in the US. And I wasn't born here in the US. I'm originally from Greece. So I'm not even fully familiar of all the intricacies and complexities of the American healthcare system. Maybe Will can shed some light on that. But I think this is the key issue here in the US because health insurance is so expensive. And because not having it means like you basically cannot get the care that you want or that you need. So I think right now, at least in Rhode Island, the insurance companies are doing the best that they can. And the governor is trying to work with them to make sure that people get coverage and start testing as many people as possible so that we don't get to the point where all these people actually need to be hospitalized.
So Will, could you all add anything about the response of insurance companies?
Yeah, I mean, I think that was well said. I think it depends. It depends on the type, because we have private health insurance. It depends on the type of insurance you had, and people have different types of coverage. I think the other thing is because in America it's usually tied to your employer. There are a lot of people losing jobs, and to some extent they would also lose their health insurance there. I think I've seen some articles about insurance companies lowering premiums and so on, but there's the financial equation of health insurance is very complicated because there's upfront costs for the patient, and then there's costs for the hospital, and then there's costs sort of down the line as well, and those were complicated before coronavirus. I think there are federal and state efforts, I think, to contribute to aid for people who won't be able to afford it. But I think at the end of the day, some people are going to go have medical bankruptcy related to it potentially, and some will be fine, and it'll just be another type of claim. But I don't know if there's been sweeping initiatives to solve that. Sam, I mean, with as far how, I don't want to jump in and interject with my own question, but I'm curious, like, what it would be for you guys, because your healthcare system is a bit different.
Well, I feel very privileged and like a little bit ignorant, because when you asked that question, I was like, COVID-19 insurance Canada, and I was like, what does he mean? I'm like, oh, health insurance. Oh, we're fine. We have health insurance. I was like, that's not an issue. I haven't looked into like in depth into see if everything is covered, but generally like all hospital visits, all checkups, all treatments, things like when there's a vaccination, that'll have to be another conversation. But I'm assuming like, so some are, we usually do have to pay for vaccinations, for example, but I can imagine that the government will want to provide those for people, but I don't know yet. So that's a very nice thing for us to be able to have health coverage, and that's something that all Canadians have. So
yeah, and
I mean, we don't have prescription coverage as the thing, so that's different, but I'm assuming that most people who have COVID-19, I don't think there's a prescription that can really help them anyway.
Yeah. The one anecdotal story, and this is one person, one story. I did have one of my friends who is also from Greece and is a PhD candidate here in the US. And she was doing a research program in LA, and her insurance, and she was getting a specific insurance that was for international students in that particular program. But there was a moment where the entire system of that company kind of crashed for a few weeks, and they didn't let anyone know. And they had a few weeks where they had not made a decision on whether COVID-related treatment would be covered or not. So for some people, that there was a moment in time where you were not sure if you were to get this highly dangerous and the main health issue that you can get by going to the grocery store. You did not know if that would actually be covered. Like, you could still have health insurance. You could have been paying for health insurance and that not covering your COVID costs. Thankfully, they went back. I think they realized that there's no way that you cannot cover it. But it did add to anxiety for sure.
So Sam, like she just mentioned grocery store. So I am curious to know, like, when it first came, the situation, the COVID came to Canada, how was the initial response of people? Was there any panic buying? Was there any shortage of essential items? So how did it was the situation in your country?
Yeah, it definitely panic buying. We had the same, no toilet paper and things like there's not very much flour left. At first we thought we were not gonna be able to leave our houses for maybe months. And I thought that too. So we stocked up, not really stocked up in things, but there's 4 people, I live with 3 other people, and we live really close to grocery stores, so we were never really worried. But I know members of my family and other people who bought enough to survive for months without going outside. So at first the shelves are pretty empty, but I've been to the grocery store since, and it seems like back to normal at this point, that there's a lot there. There might be some things that there's missing, but there definitely was that panic buying. But now I think people are realizing I can go out for groceries every week or every couple weeks. And hopefully the community, we have a Facebook group that a lot of people in Halifax are in, thousands of people. And that's where people ask for if they need someone to help them buy groceries or if they need support in different ways. I do see a lot of people, including myself,
And
who
are there...
Sorry, go ahead. I was just saying, some people are trying to be a little bit more self-sufficient, taking up things like gardening, but that's obviously not feeding us right now. But I think we're all kind of coming back to how can we be sustainable if the world is changing.
Are there any cash on delivery services, like home deliveries services going on right now? Yeah,
we have the grocery stores have home delivery, but there are some points where groceries wouldn't come for 5 days because they are backed up that much. So I know that some people's needs went outside that, but we do have delivery. We have the apps that you can, so a lot of the restaurants are all closed, of course, but a lot of them are still doing delivery. Things like Skip the Dishes and Uber Eats, those type apps you can get food delivered to.
And Natalie, how about the situation in your state?
So grocery stores are still running, and we do have home delivery. We also have a couple of mutual aid programs where you can sign up to help people get groceries. And I guess there's two sides of the mutual aid. People sign up when they cannot go out or they cannot afford to get groceries. And it's usually elderly people or immunocompromised people. And then on the other side, you have the volunteers who can go and actually get those groceries. So our hub is actually involved in something like this. And I have gone out a number of times and got groceries for families who either cannot afford it or it's too dangerous for them to go out. But again, it's very much, people self-organizing to help each other. And it's one of the beautiful things that have come out of this, like the kindness and the generosity that we've seen is pretty incredible. Did I answer your question? I think there were two parts of the questions, and maybe I answered one.
Yeah, one was how was the initial response in panic buying?
Oh yeah. So there was, I think, our panic buying happened once the president announced the national emergency. I think it was a Friday, and there was no toilet paper to be found anywhere. Right now, we also cannot get Lysol, like any disinfectant wipes or anything like that. I have not been able to find any in weeks. On the toilet paper and the flour and the sugar and all of that, I think we still have shortages, but it's just a matter of figuring out when those stores are getting the shipments in and to be able to go at that time. So it's not a real emergency, but it's just a matter of timing and just figuring out when you can actually go and where you should go to the grocery store. But I have to say, one of the things that I first had to do, because I was running low on toilet paper before this whole thing happened, and I went on Amazon and ordered, 8 rolls of toilet paper for $30, and they're still not here. So luckily I had friends who brought me rolls of toilet paper, with ribbons and all of that. And I think that's going to be my birthday gift for this year. That's it.
Very nice friends.
Strange times.
Yeah.
Strange times, like toilet paper is being gifted for
Yep.
birthday. So Will, do you have anything to add? And particularly, what was the impact on markup prices? Like, did prices shoot up because of all this?
Yeah, good question. I don't know. It's interesting because we haven't seen that type of shortage as far as I can tell, and I don't go shopping all the time. But I have a grocery store right near my house, and one day maybe there wasn't toilet paper, but the next day there was, and they were regulating purchasing at the two near my house, so you can only buy so much of essential items. I didn't notice personally any price gouging, but I do remember there were a lot of articles nationally about it, including people who on Amazon had stocked up on all these items and had then increased the price, and then Amazon removed them from the platform and didn't let them sell it at higher prices. And then one guy, I think in Tennessee, got different DOJ offices, the Department of Justice went and raided, I think in both New York and Tennessee, people who were hoarding protective equipment and cleaning agents, which is interesting, but that definitely did occur around the country. I think in Wisconsin, I didn't notice any of that.
What happened in our city was that we ran out of hand sanitizers, and prices went up like 4 or 5 times. So what our hub did was we partnered with local industry, and we started manufacturing our own hand sanitizer to distribute within the city. So we manufacture 100,000 bottles of 100 ml. So we distributed it in like 1 month. We distributed it in hospital, medical centers, district. We gave it to local government. We gave it to airport authorities, and so to our partner organization. So we tried our best to use our links and partnerships to serve the community at this time in this way as well.
Good
So,
for you.
yeah. So I think I have question from again from you. You have some sort of experience and insights in entrepreneurship and technological innovations. How do you think this crisis has presented new opportunities in the economy, new economic opportunities for the people?
Yeah, that's a great question. I think, well, sort of almost to segue off the last question, what's interesting is that you've also seen a shortage of some of the supplies. So like that it's amazing your hub was able to put that together, because one thing is like there's sort of these secondary and effects of companies that were previously making other things are now making cleaning agents and so on, but the raw materials aren't available. And something we haven't totally talked about yet is the really short and long-term effects on the economy of this shutdown. And so there are sort of these the cost benefits and so on, and the public health concerns. Depending on what we'll see is this rollback and or roll online of, okay, now we're going to bring such and such jobs and which jobs are essential. And I think tied in with that are which ones are in some ways economically helpful. And I think there's a new economy, and some of sort of the entrepreneur circles I've been in are discussing and doing thought experiments around what is the new coronavirus economy or work from home economy. And I think knowledge workers were already very well placed for that, so that people who are in roles where they could easily work remotely are in good shape. But manufacturing jobs in the service industry and a lot of others, it can be really difficult. And so I think we will, and on the other hand, you have a bunch of really bright people sitting around with nothing to do now, who are, which is a sort of recipe for a lot of technological innovation. So I think we'll see a number of new startups come out of this where their origin story will be quarantine, including like bands and music projects and all sorts of really creative things. In some ways, it's a bit of a luxury for those people to be able to do that, take 8 weeks and not do anything and be able to sustain themselves. Separately, sort of in the traditional venture capital space, I think we're seeing there's a bit of a pullback, but in sort of the initial shock of money will be flowing differently. But on the other hand, there's also a number of investors have said, no, this will be a great time to buy if valuations are down. That means comparables are down and I'll get better deals. I think we'll see over the next few months how the larger economy globally and nationally shakes out. But the other final thing I'd say is I'm surprised at this point that you'd think there would be some sort of, I think a very successful, here's a tip if anybody wants to run with it, a very successful startup would be a game that people can play remotely together. I think there's a lot of them, but there isn't one that like a lot of people are doing Zoom trivia calls and all sorts of Zoom activities, but I think the gaming industry would obviously get a big boon from this.
Oh, you're on mute.
Yeah.
Okay, sorry. What I have a question for you. Like Sam mentioned about the grants the government in Canada is giving to their businesses, to the people. So is there any sort of a program in your state, do you know about, or any other way in which government is supporting its people?
Yeah, so I mean, on a national level, we have the PPP, Paycheck Protection Plan, which is the program to give low interest loans to small businesses. And the first round, I think it dried up within a matter of days because so many businesses had signed up. So we're now in round 2. So there's a lot of small businesses here in Rhode Island that are hoping to get support through that. But at the same time, I know our state government is working with financial institutions to help small businesses and homeowners and renters, kind of looking across the board at how we can be supporting people. And right now, there's, I think, a coalition of about 20 financial institutions, banks and credit unions that have agreed to not report any late mortgage fees so that they don't harm your credit score, to not go after payments, So that is one effort that is being supported and kind of organized by the state government. And there's also another plan, I think they just announced it this past couple of days, to have $1.5 million in rental assistance. I think they're not still 100% sure how they're going to deploy that and who it's going to go to. But they're trying, to the best that they can to work with the local businesses, and mostly small businesses, because Rhode Island does have a high percentage of small businesses that are being hit pretty hard right now. So we're hoping to see what happens with this, the second PPP.
What I am also curious to know about is that how is government managing all this after this oil price crash? Because I understand that U.S. economy is like one of the biggest exporters of oil. So how is government coping up with this, and how it is reacting to this situation now?
That is a very good question. I'm actually not sure what the Rhode Island government is doing specifically around oil prices. I'll have to check on that. I don't want to relay any inaccurate information.
And do you have any idea, Will, about this?
I think you're mute.
No, I am not mute.
Sorry, I'm muted. No, I think the federal, I don't know, the individual industries in oil has an effect on a lot of people. It is absolutely in the central and southern states like Texas. It's a huge problem, the oil glut, and America's getting hit pretty hard. And I think how that'll shake out and what the government will do about it is sort of a chess game between public and private interests. I think so far we haven't seen anything about it yet, but it's definitely tied into the larger federal backing of various industries that they think will prop up the economy. But it's a good question. For the individual consumer, day to day, it's kind of nice because people can fill up their tanks for lower, but the macro effects of it are generally probably going to be negative.
You can fill up your tanks to go
Sam,
nowhere.
coming to you, I think the same situation is for the Canada. Canada is also a major producer of oil. So there are, like, it is one of the largest producers. So how do you see the impact of this oil price crash on your economy?
Yeah, I've heard on some of the federal briefings, journalists ask our prime minister, like, what are you going to do right now to help the oil industry? And it's more general, like the response is usually, this is what we're doing to help everyone in every industry. This is how we're helping businesses. This is how we're helping people. And then later on, we'll discuss like how specific industries can move forward. Honestly, what this, like, one maybe good thing out of all this is that this will be an easier way to transition to more of a green economy. Like my friend and a shaper who works in the oil and gas industry said, people are getting laid off and they're probably not getting their jobs back. At this point, like the oil prices are so low, but will they be higher, and will government say this is a good time to transition to more renewable energy sources, therefore these jobs will never come back? And I think we just have to make sure that we have a good transition for different increasing skills for people to get jobs in other industries, and make sure there's enough support for those businesses people. But I think instead of having it happen slowly, it might just happen even more quickly because of the situation. And I don't know that much information about it, but I think it's a really great thing to start thinking about. And hopefully our environment I know that it's healing right now, and maybe this is a good transition to more of a green economy.
Okay, I think green is the future. We as a shaper are also advocating for green economies all around the globe. I was reading an article today that it is for the first time that many square kilometers of area has like over the ozone area has repaired itself. The hole has been filled. So I think this is a good thing for the environment as a whole. Our city in Faisalabad, it is an industrial city, and it has been like one of the most polluted city in the world. It was ranked number 3 because of all the industry. But air quality has improved so much right now that like it is not the same city now, just because all the industry is closed. So Sam, coming to you again, given your background, the story I was watching, your story, which you was showing on Instagram feed about the online classes, digital shift for children, digital games. So how do you think that the whole situation has impacted the education sector? Has there been any boost in digital education, especially for the children?
Yeah, I mean, absolutely, there's a boost in digital education. I did a focus group last week with educators in Canada and the United States. The problem is not everyone has access to technology, right? So some kids went home where they don't necessarily have products that they can use to get online materials. So some schools are still having paper materials delivered. Either they have them at the school and you come pick them up, or they bring them to an area where a lot of the children's parents are working, so they have paper-based materials. Of course, I feel like this is a good time to transition to digital learning. However, like this is such a fast rollout, right? That teachers aren't ready. Districts aren't ready either, and students and parents aren't ready. We've seen that parents are overwhelmed with trying to work at the same time as manage their children at home as well. So yeah, I think that digital projects for education will be on the rise, but I think that not everyone's ready for it right now. And it also includes things like we have to make sure that everyone has access to this technology, because people who might be living in poverty, who don't have access to this technology, now they won't get the education that they need, which is just reinforcing that cycle and unfortunate. So I think that the government has to decide what path is moving forward. And I think that every school district, and there are thousands and thousands of school districts, have all dealt with this by themselves on their own. And there has to be like some overarching strategy to support everyone, because I think everyone's just a bit overwhelmed. And I know that some states or some districts and states have decided to end early. And a lot of like most state, I think all state tests aren't happening. But then what happens when people go back to school? Are they going back in September? Will it be safe enough to go back in September or not? There's so many question marks, but in general, I think the kids and parents will remember this was the year that education was really put to a halt. Because
do you think post-COVID, there will be a different world in terms of education, or will we continue back to the old conventional system of going to schools? What do you, as a startup, what do you think? Like, you are working for an education sector, so what's your insight on this?
Yeah, I've actually visited Providence and gone to a few different schools there because we have a lot of users there. And a lot of people are already having a blended learning environment. So they're using technology in the classroom. So they have their traditional lessons, or sometimes they don't. Sometimes they use one app to record what they're doing that their parents can view. And then they have one station that is paper-based and one station that's a game. So I think that blended digital learning is happening anyway. I think that, but at the same time, I think teachers are still so important, especially for the side of understanding a child and helping with their development. Maybe some things like education can happen online, but what we're also seeing is that children need interaction and communication as well. And I don't think that can be all transitioned. So I think that we will continue to go back to the normal model of going to school, but maybe we'll be better prepared if this has to happen in the future.
I think one of the biggest challenges I saw in this situation was even the private schools in Pakistan went digital. And one of the problems I experienced was that I have 3 siblings and they had classes at the same time, and we needed 3 different devices for them. So that was a major issue. So which I think the schools also need to take in account for. But now the government has started on channels on TV, dedicated education-based channels, and it has like unified curriculum for the whole country. So like up to like 8th graders or 9th graders, they can learn online. So this has been one of the initiatives taken by our government. So Nefali, would you like to add on to this?
Yeah, sure. So right now, Rhode Island has decided to continue the school year remotely, and schools could close like end the year earlier. I think as long as they complete their 180 days, school days. We've been on digital learning, I think, for about a month now. And the government has coordinated efforts to make sure that people do have Wi-Fi. So right now, if you do have a smartphone, you can get unlimited free data on your phone and use it as a hotspot, so kids can learn. And there are also, I think, either no cost or low cost options for Wi-Fi at your home, just to make sure that every household in Rhode Island is actually able to facilitate online learning. But I think, the school system here, and I don't know if it's the same in Nova Scotia, I think it makes us realize how much more important the schools are beyond just the learning. And I was actually talking to one of my friends today who's on a school board, and we were saying that the school is where a lot of kids, and especially kids from low-income communities, get access to the internet, books, meals. So once that closed down, the government to figure out what to do with all three. So they are putting out a number of resources, and there's like a free helpline for both educators and parents when they're struggling, they don't know exactly how to handle learning at home. And at the same time, schools are still open. Most schools are still open for meal deliveries. So kids can still go and get the meals that they would normally get. And the interesting thing about Rhode Island is that because we're kind of so small, everything is handled by each district. So the state government is going to tell you, like, you have to remain closed until the end of the year. And they did try to get at least everyone's schedules aligned, so they can have coordinated meetings and coordinated efforts when it comes to timing. But other than that, every school district can figure out how to best address the needs of their students and their communities. So some are distributing meals every day. Some are distributing meals twice a week, but just multiple meals at each time. So, I think they're doing the best they can. I'm glad to hear that Providence has been one of your good clients. It means like we're trying, we're doing something even before this whole thing started. But I think it is the big issues and the big questions might come after the summer, once we've had kids go through a few weeks or a few months of distance learning, and then the summer where you get, for the most part, no learning. So what's going to happen? What is the next year going to look like, and how much catch up will students and their parents and their educators will have to play to fill in the gaps?
I think this is an interesting insight. Will, what I would like to know from you, given your background as an attorney, has there been any increase in litigation or decrease in litigation? How is it coming along? How are people litigating these days? Are you providing any online services?
Yeah, for me personally, no change yet. I think the industry has seen a number of trends pull back. A lot of the big firms, like the world's largest firms, are taking precautionary cuts, which would, I think, tend to show a potential slowdown in both transactional and litigation work. Some industries are going to see a big pickup: bankruptcy, distressed transactions and acquisitions, and insurance. I think we touched on health insurance, but the broader sort of business interruption coverage and different types of insurance will definitely see increased litigation. So it sort of depends on what industry you're in. On the other hand, businesses for commercial litigation will have less cash on hand. It might not be worth it. Like, lawsuits in America are very expensive, so it might not be worth it to bring them. So I think it'll be interesting. So in general, maybe there'll be somewhat of a decrease with some areas increasing, but it's a good question, and we'll see.
So now, leaving this topic aside, coming to your personal life, how has been the impact? Do you find this situation to be like better in terms of you having more time for family, to do your personal stuff, the things you have not been able to do until now? So how this whole situation has impacted your personal space?
And is that back to me to start?
Yeah.
It was interesting because I was actually busier than usual for the first few weeks. In part, I think because everybody was home, they were forced to be at home. They were all available, so that every time you'd send something out, you'd get it back immediately. So I basically was working nonstop the first few weeks because people didn't really take those weekends off, which was a little unusual. Now that's finally slowed down a bit, and I would say I don't know. This morning I was thinking I should find a hobby or something because I'm anticipating I'll have some more time. So I think it's been interesting. I'm lucky that I was also living with a good friend of mine who ended up moving next door. So we have with his girlfriend, and so it's a more social quarantine, I think. But it's definitely weird. It's unusual, and even going back to being an attorney, you have a lot of social and personal interaction with people, like from depositions to dinners or coffees or whatever, and that's sort of all gone. So it's definitely slowed down. It's a lot of Zoom meetings. I think a very common thing you hear is a lot of people like get on Zoom with their family for an hour or two once a week, or like with my friends from high school. So that's about all I've done.
Okay, and Natalie, are you a Zoom person?
Oh God, well, I became one. I had to be one. And I think as great as it is to be able to work remotely and to have these technological options to allow us to move forward and still have an income, I think we have seen there's also sometimes like just too much of too many Zoom meetings, like too many people trying to get together, at the same time. Everyone wants to talk to everyone. So one of the projects that we're doing with Shapers is going to be around mental wellness, and how it is great to seek companionship and just interaction with people, but also to not feel inundated by those requests, and to be, we might be on a lockdown and might have this physical distancing, but it's also perfectly fine for me to spend time by myself. Like I still have that need. So that's the one thing that I have seen in my life, because I think there was a week where I had, I don't know how many work calls on Zoom, and then as many personal calls on Zoom. And at some point I was like, you know what? I just want to be by myself and with my cats. That's it.
We cannot see your cats anywhere in the background.
They're surprisingly quiet right now.
Yeah. So Sam, how about your daily routine? What have you found any hobbies? What is your day like?
Well, you watched my whole day, so you might be able to talk better about my new hobbies. Yeah, I honestly, some people have said, like, seeing on social media what me and my house are doing, is like we are thriving in this environment, and I think I'm just really happy. We have, like, Halifax, some houses are really not very expensive to rent. So I have this beautiful 3-story house that's like really like 5 minutes from a main street in Halifax. We have a backyard. So we've built forts, we've had movie marathons. I also live with 3 other like very fun people. So we've had a pretty good time. Like, I mean, in general, I am getting overwhelmed with the Zoom calls as well. I feel like it was more overwhelming at the beginning. And now I've said to myself, just as in, like, I don't expect to hang out with 3 separate people in one evening after work. I don't need to have 3 separate Zoom calls to see my friends in an evening. Like, that doesn't make sense. So in general, just trying to have a balance between what I want to do, what I need to do for work, what I need to do for Shapers, and how to support my friends and community too. But I'm okay. I found like this weekend was a turning point, and it's been about a month and a half of this life. Now it seems like, okay, I can get routines. This is getting to normal, whatever normal is right now. And hopefully we can just increase our happiness in this space, and know that if what I need to do is stay home, I can stay home.
So one question, like, how is your hub managing its operation, being quarantined at home, if everyone is at home? So how are you managing your initiatives, or what sort of initiatives the hub is like taking up right now?
Yeah, so I find this is a lot of either it's immediate action or it's planning time in general. I think that a lot of hub operations, in terms of hub meetings and other things, it's more about connection, communication, checking in on everyone to make sure we have that community support when needed. For like one of our main projects right now is to increase ridership in public transit in Halifax. And we're trying to think of, okay, now public transit, for example, right now is free in Halifax. And other cities have seen, like, if you make transit free, there's an increase in ridership by 28%, and therefore you can have better routes, and just in general, it increases the experience. So can we do the planning now so that when people are ready to go back and use transit, they're more comfortable doing so, and maybe the municipality can do something to make sure it's more accessible to people. So I think we're trying to think of how we can make lives better in the future. We were thinking of doing a similar needs matching service as Nefeli was talking about. And it's hard to balance. How can you do something to help the community, but at the same time, not create any harm necessarily? Like, we found a lot of the needs matching services, it was sharing personal information, and we weren't comfortable doing that. So I think it's difficult to know, let's act immediately, but we also have to take a step back and think what's best for our city. So in general, that's what we're doing. I think some people have a lot of energy to spend in Shapers, and some people need to take a step back, and that changes weekly depending on people's situation. So I think it's a time of flexibility and being able to be open to different things.
Great. So, Nefeli, how about your hub? How are you managing all the operations, and what sort of initiatives is your hub taking up right now?
Yeah, so we obviously moved all of our meetings to be Zoom meetings. We were giving the option to people before when we were having in-person meetings, like if you wanted to dial in, that was still an option. So I think we had kind of a smooth transition into the completely remote work. As Sam said, I think people are having different experiences right now. So, some of us are lucky we still have our jobs. We have a good routine for the most part. Others might be experiencing some, financial hardships. So it does vary how people are, connecting to the work and how much energy they have to give. But right now, in terms of our initiatives, we were already working in the homelessness space. And we're going out every weekend to an area in Rhode Island where it has been traditionally underserved when it comes to having enough services for people to apply for housing and caseworkers and all that. So we were getting trained in understanding the housing system and how to fill out housing applications for folks, and going out there to build those relationships with people and help them fill out those important documents. And now this has stopped. So now we're in the process of finding how we can adjust our work to this remote environment. And so we're about to schedule a stakeholder call with all the people who are involved in that area and in that process to figure out how we can do that. And I think this is one of the really cool things that have come out of this. Especially in Rhode Island, we have a plethora of nonprofit organizations, not just focused on homelessness, but across the board. And I think we've seen collaborations and kind of task forces of different organizations coming together that we've never seen before. So now there is a standing meeting with all the homelessness organizations to try and coordinate efforts all together, where in previous times there may have been some competition because they're all fighting for the same pool of funding. So right now we're trying to see if there are tools or resources that we can create right now that we're all still remote before we pick things up again at some point, maybe in the fall. We have also been 3D printing masks and delivering them to volunteers at Meals on Wheels, which is an organization that delivers meals to seniors. So we have a shaper who works for J&J, and we just have been using his home 3D printer to help us print those. And it takes a while, but I think we've now given masks to more than 50 people who are delivering groceries on a regular basis. So that's multiple routes per week when someone is protected. Especially because they're getting in touch with elderly and otherwise immunocompromised folks. And so we will continue to do that. And then the last thing is around mental wellness that I mentioned before. We are now just starting a partnership with Peace Love, It's an organization that is actually having a partnership with the Global Shapers community at large, but they are local. They're founded here in Rhode Island. So they're using expressive arts to help address mental health issues. And we will be getting trained to deliver some of those workshops. We've actually gone through them. They're really fun, and we're now doing it on Zoom. And you get to draw and make collages and stuff, and it really helps take a little bit of the burden off your shoulders by doing something that is fun and creative with other people. And it also helps connect the members of the hub with one another, on a call where we're not focusing on the work that we have to do, but it's more personal and fun. So, but again, we're constantly trying to figure out what else we should be doing. So it's an ongoing effort.
I think one of the best things from your discussion I picked up was that the collaboration your organization is doing in philanthropy space in like they are trying to come together to help people. I think this is one of the great things on part of the community as a whole, and all of our communities should learn from this, should have a lesson from this. Secondly, I would definitely like, if possible, your hub to train our shapers on this mental health thing. What you learn from Peace Love, you can pass it on to us so that we can also pass it on to our community in local languages in which they can better understand it. So yeah, I think this can be a good collaboration as well.
That's actually the plan, and that's what we have been discussing with Peace Love. Once our folks get trained, we will then start training other hubs, and then those hubs can share the workshop with their communities.
They count us in.
Yeah, great.
So Will, coming to you, how about your hub and how is it managing its activities, and what sort of activities are going on currently?
Yeah, and definitely count us into. I think that sounds interesting. I'll have to look up Peace Love as well. So it was interesting because we had for the year we've been prepping on a big Earth Day project where we're going to be coordinating volunteers and sort of taking a measure. Earth Day, I think, started in Madison, and it was the 50th anniversary. And Gaylord Nelson is from Madison, and so it was sort of this whole big initiative we had planned, and so there's a ton of stuff around it already, and we were going to compile a bunch of data on that impact, and then also organize new groups of volunteers, and so that all sort of got shelved. And we repurposed our website to be COVID resources, and then which a bunch of hubs were doing all sorts of resource alignment. And so we began to do that, and then merged with another group in Madison that had created a similar document, and sort of that's ongoing, but not super active now because a lot of the resources are accounted for. And so then we started doing, about a month ago, a bi-weekly food. We go to a place called Second Harvest, and we all just volunteer and contribute hours, where you pack boxes of food for families that come pick it up. And so we did that yesterday, and we plan to continue to do that. And then apart from that, sort of our recruiting has changed a bit, and we're working on sort of new way. We still meet weekly, and are sort of come up with, prospectively, what should we be doing and what can we be doing differently. It's interesting to sort of track a lot of the other international initiatives. I think there's a lot of good ones going on, and the Peace Love one is a good example. So I've definitely been impressed by a lot of the other hubs I've seen, like yours, making hand sanitizer and stuff. And so some of those, we can't model all of them, but I think there's been a few. So we're sort of looking into what our next best steps would be. But so far, the main thing now that we've done the resource compiling is the food bank, which has been good.
Great. I think all of the hubs are mostly working in the same domains. Like we are also working on awareness, translating WHO messages to local languages, then making videos out of those messages. Then we are partnered with local organization, news channels, universities to distribute those resources. Then hand sanitizer thing. Then there has been a lot of unemployment lately, and especially the informal sector, the labor class, daily wages, they have been fired. So we have been trying to provide them with food rations So we've up till now, like we have provided them around $60,000-$70,000 worth of food rations, by obviously with the support of community. So I think all of our hubs, all the global shippers hubs, are more or less working in the same domains. And I think this is very interesting to see. It is a source of motivation when we see on top link that we see an initiative, we get inspiration from it. Okay, this is also what we can do, exploiting using our partnerships. So like it has been a very good thing for me as a new shaper. Like it has been less than a year, or I guess a year or so. So I think this community is great in the sense that it brings everyone together in initiatives like these and give potential for collaboration. So that's great. Coming back to you, Sam, how do you see the future of all this? What would be the post-COVID world to you? How do you see this?
That's a really hard question. I don't think any of us know necessarily. I hope that it's a world that's more connected. Like I feel like through this, even though we can't see people as much, we talk to them and we're seeing what's happening around the world. So I hope that there's more compassion now that we've gone through this whole thing together. So now we can see everyone as human and have better connections in the world. I think it's going to be a long recovery time though. At the same time, like I think that our governments, honestly, I don't know enough about. I feel like we should just wipe all of the money around the world and just give it all even, and then we can restart again. And I know that it's a lot more complicated than that, but I know that every country is going to go through so many hardships because we're all going to be in debt. But I hope that people can see that we need to innovate continuously, and the world is changing, and we have to make sure to keep up with that. At the same time, we have to take care of ourselves and our family too. I know that was like a roundabout answer, and I don't have one, but I don't know if anyone does.
None of us have an answer, but we can only give our perspective. So Nafeli, what's your perspective on this?
Yeah, I mean, there's so many aspects of it. I think, like Sam said, it would be really interesting to see how the nature of work is adjusted to have more empathy and to be more human. I think up until now, at least my experience has been that, you know, in order to be professional at your job, you had to be kind of less of a human, like show less of your family and less of just like our human condition. And now that we're all kind of confronted with this big, extremely complex and extremely serious pandemic, it's kind of pushing to the front what is really important, and how we can actually work together and maybe more efficiently and more effectively. So part of me, even though this is a tough situation, I think it's hard to be, you know, purely and 100% excited about anything. I am excited to see how our generation is going to just deal with life in general. We've experienced two big crises, and I think it's going to do wonders for our agility and our, you know, ability to show up and adjust and find solutions, and, you know, just weather the storm. So, you know, that's really interesting. And on the negative side, like one thing that has been on my mind is, you know, on a global level, what are the policies that might be getting passed right now because there's an emergency, or because people are not paying as much attention to one thing because everyone is so focused on the pandemic. And, you know, crises are interesting times for, you know, governments to deal with things in different ways. And, you know, the rules are kind of different right now. So I think we all, and as shapers in particular, we need to be paying attention at what's happening on a local and a regional and a global level, around, you know, how our you know, basic human freedoms are being handled right now.
Very insightful. Will, I would like to have your perspective on this as well.
Yeah, I think obviously a difficult question, I think, but that was well said by both of you. I think we will see, as Nefeli said, a lot of innovation globally. I think we've seen that already. And I think I would agree shapers are uniquely positioned to sort of do a knowledge transfer. I'm impressed by what I've seen so far about, what's working, what hubs, what do you guys think of this and that? I think it's also interesting because it's in my lifetime, and I think uniquely maybe beyond that, truly a global crisis where it's this, everyone is experiencing this, some of the same problems at the same time. And I think there's a lot of unique and idiosyncratic issues that different cities, countries, regions, like counties face. But it is a sort of coming together moment for a lot of the world, which has been interesting to see, and especially to see as being part of the global shapers. So I think that's been pretty cool. I think there's a lot of difficult questions that are going to come up, and especially I think, and we're seeing them in America definitely, of what is the government's role in supporting in working through these problems, and it's a very difficult question, and will play out in different ways in different states and then federally, which I think will be interesting to see. And I think it'll be difficult for a lot of, I mean, obviously there's our unemployment rate is skyrocketed, and there will be a lot of businesses affected, and some of the initial programs, are taking initial steps to help out, but I think it'll be a difficult time. So we'll see both a lot of innovation, but then a lot of sort of, and some of it by necessity. And we'll see, but it's definitely that's, I guess, what the other thing is interesting is it's difficult to predict. This is like untrodden territory for health models, financial models, for everything. So it's interesting times.
I think what this crisis has done is that even I don't know how rest of you see, but it has brought us together, even though we are divided by boundaries, but still it has become world more closer. And not only the world, but our relations, like we as families, we as friends are now more close to each other. I think that's one thing maybe which we can carry on after this crisis is over. And secondly, I think the role for technology, it will revamp a lot of industries. Like everything will be revamped in light of technology. It was at one point in time, no one had thought that in places like South Asia, like in our part of the world, that children could go for online digital learning, and no one could convince parents to do so. But in just this 1 month, we have seen rapid changes, and people agree or not, whether people liked it or not, but they are forced to adapt to those changes. Even the elder generation, which was not used to technology that much, like my parents and other family members, I am seeing them using Zoom as well right now. They are using all digital platforms to connect with each other. So I think this shift is permanent, the shift in technology, especially in developing part of the world. So that's my take on the future, how I see it. So now, before we end, Sam, one last message, specific observation, which you would like to share with rest of us, rest of the people who are watching right now, or those who will be watching this later on. So please.
Yeah, I'd say you have to work inwards to outwards. Take care of yourself, take care of your household, your family, your friends, take care of your community, take care of the world. But what it all has to come to is you can't help anyone else if you can't help yourself, right? So take that first, and we'll be all in this together, but make sure to always check up on yourself and whoever else you can.
Natalie?
Yeah, I mean, I agree 100% with Sam. I think we have all experienced a lot of emotional and psychological ups and downs, and it changes on a daily basis. And I think it's impossible for us to, even if we are fortunate and we have certain aspects of our lives being taken care of, I think it's impossible to not feel the burden that everyone else is feeling, to not be affected by the struggles that others around us are experiencing. But I guess the one message is that it's okay. Like whatever you're feeling, it's totally fine. No one knows how to do this. And I don't know, I try not to be on social media as much, but whatever we might see out there about people using this time to start a business and write a book and be super healthy and like do all of those three things at the same time, it might not all be true, and it doesn't have to be true for you. So it's also totally fine to spend your time doing nothing. Like this is emotionally heavy territory and uncharted territory for many of us. So take it easy to the extent possible.
Well,
Yeah,
what's your
I would only add that I think both of those are well said. I would only add, and don't be afraid to ask for help. I mean, I think a lot of people, as you're saying, it's uncharted territory and there's highs and lows, and there's plenty of resources out there, and a lot of like really both that the hubs have done and private and public industry have done, and whether it be mental health or financial or other reasons, there's a lot, like, it's, don't be embarrassed to reach out and ask for help, and everybody's going through the same thing. So it's definitely okay. It's a difficult time for everybody for different reasons.
what I would like to add, what my take is that it is high time that we as a community, we as individuals, especially as shapers, we show empathy towards the people in the community, especially those who are facing struggles of any kind, financial or emotional, mental. We need to like support each other as shapers and learn from each other to support our communities in a better way. So that's what I think we should be doing right now. And with that, I would like to thank all of you for taking out so much time to be part of this session and sharing your insights from your regions. It was great meeting you all, and hope to stay in touch. And definitely, we would like to be part of this collaboration on peace, love, mental health collaboration. So I'm looking forward to hear from you soon, Nefeli.
Yeah, absolutely. Thank you for having us.
Yes,
Yeah.
thanks for hosting us, and thanks for staying up.
Yeah, time for bed for you.
Yeah. Thank you very much.
All right.
Hope
Thank
to see you
you.
soon. Thank you.
Bye-bye.
Goodbye. Goodbye.